But first, a check on our finances. Now, many people are suffering during these economic times. It can be even more difficult for adults who take care of their own families, plus their elderly parents. Financial advisor Rob Wilson is with us this morning with some advice to help ease the burden of the sandwich generation. Good morning. How are you?
I'm terrific. How are you?
So where do you get started if you're raising kids and you have your mom or dad living with you?
Well, I think it's even before that because, there's a lot of things that we can't control. I don't like worrying about that stuff. We should control what is going to happen in our lives. And so that your parents are going to be elderly at some point, are going to need care. So you want to think about putting a long-term care plan in place. Your insurance that you get through your employer or Medicare is not going to pay for these tremendous costs that it takes to put your parent in a nursing home. So if you can put a long-term care plan in place when you're young and when you're healthy.
When it's cheaper.
Right. And if you do need those services, that insurance policy can take care of those costs.
Okay. Now give me an outline. I'm married, I have 2 kids, and I find out that my mother is coming to live with us.
Sure.
Is there an outline that I need to follow?
I think there is. I mean, first of all, you want to understand what their financial picture looks like. What kind of assets do they have? Where are they? Do they have a will, a living will, or a trust? Or you need to understand what all those issues are, because you may be the person who's going to be responsible for making those important decisions in the future. So I think that's where you start. There's also Medigap insurance that you can have your parents purchase, which will cover some of those expenses that, say, Medicare doesn't cover, like co-pays and deductibles and so forth. So that's something that you can put in place. Also, if your parent doesn't want to live with you, if they do want to stay in their home, you can think about doing a reverse mortgage, which is where your parent can take a loan on their home and get income from that every month, and they do not have to pay that back until they either move out of the property or they pass away or they decide to sell the house. So that's some way that they can have some income.
Do you still own the home when you do a reverse mortgage?
You do still own the home, but there is a loan on it, so once they move out or pass away, typically the house is sold to pay that loan back.
Okay. What are some of those mistakes that people make?
I think just not planning. I mean, 40% of seniors at some point are going to need to be housed in a nursing home. And right now there's 34 million people in this country who are providing informal health care to their parents. And what that means is if I have to do that, that may affect my job. I have to take time off away from my job, take care. I may make less money. And some people have even been fired or quit their job because they have this burden. So I think failing to plan is an error in and of itself. So you need to think about that in the future. Okay.
Now, is this something that young people should think about, like out of college when they get their first job? Like, my parents may live with me. I'm going to be married one day. Should they be putting money aside already for that, with that in mind?
I think if you have a candid conversation with your parents and you say, hey, Mom, Dad, I think you might think about putting a long-term care plan in place or something like that, then it'll ease the burden on you, because once those things aren't done, and if you don't have the ability to put, it costs $75,000 a year to house someone in a private room in a nursing home. If you don't have that, it's going to fall on you. So you've got to have these conversations very early on. So I don't know if you can save money for your parents to take care of them, but have that discussion and make sure they do the things that are necessary. Okay.
Now, do you have clients who have done this kind of thing and it's working out for them?
I have, and I tell you what, I mean, this is really near and dear to my heart. My mother had multiple sclerosis, and she was in a nursing home for 10 years, and we were extremely fortunate that she had a very good insurance policy which covered the majority of those expenses. But if not, I mean, that would have affected, where I could go to school and things that I wanted to do in my own life. So we were very fortunate, and it made the situation a little bit easier. Not totally easy, but a little bit easier to deal with.
Okay. And if there's several adult children in the family, is this something that you should have a family meeting about to determine what's going to happen and who's going to do what?
You should, because you don't want to overburden one child with this responsibility. There are also tax implications. So if all of you are pitching in money, you want to decide who might be able to get the tax deduction. In some instances, you can claim your parent as a dependent, and even if you can't do that, you can deduct some of those medical expenses. But you should talk to a tax professional and make sure that you meet all the tests. But you do have to have a discussion, because everybody should chip in for this purpose.
Right. And I know it would depend on the salary of this person, but in these tough economic times, how do you get a plan going like this? When people aren't making money, they're losing their jobs. How do you formulate this to get it going?
Well, starting is more important, I think, than the amounts, that you have. So the most important thing, even I talk to people who are coming out of college and they say, I'm not making any money, how do I save?
Right.
Saving $25 is better than nothing. The habit is more important than the amount. So if you do that over time, then you'll be ready. So if you start planning for this early, by the time this becomes an issue, you should be, adequately prepared for it.
Okay. I have friends who are 40, 50 years old, and they'll go, I haven't saved any money. I'm old now. It's too late. Is it ever too late?
It's never too late. When you retire, let's just say you retire at 65, people are living a lot longer today.
My dad was 96.
Right. Yeah. So if you have 20 or 25 or 30 more years to live, you better make sure that you have some type of portfolio or plan such that you don't outlive that. And one thing I did want to mention too is that you might want to suggest to your parents that they think about purchasing an annuity, which is an insurance type contract where you can almost guarantee payments for life. And so if you are, maybe you live to 100, they'll guarantee to you that they'll keep making those payments even if your principal has been depleted. So annuities have, I think had a bad rap over the years, but a lot of changes have been done to those types of contracts which make them very advantageous.
Okay, finances made simple. I understand it. Hey, I understand it.
Good.
Wow. Thank you so much for joining us this morning. All right, sure thing. Okay, now for more financial advice from Wab, you can check out his website. We have a link for you at kdka.com/PTL.